Okay, so we're going to do a deeper dive into the options for implant prosthetics. This is actually specifically on topics for full mouth or full arch reconstruction. This is patients who are already missing teeth or they have teeth that at this point are past salvaging, and it's become a great option. It used to be a poor option when we got to this, to restore somebody, to get them to where they're back to youthfulness and health. So the first thing to say is, on the screen here we have a picture of a denture. This is someone's lower mandible with 2 implants attached to the denture. So briefly, let me go into what we did before implants. There were not great options, as I said. If it was a full denture, it would just float and sit in the lower part of the mouth, usually held in by adhesive. And bottom line is the bite force and the movement, it cripples you. So thank goodness for implants. It's become the standard of care to do this. This is the baseline standard of care for replacing all their lower teeth. Would be a lower denture with 2 surgical screws, implants that are placed in strategic locations, usually in the canine region. And then they have what are called locators, gold locators, that are screwed into the implants. And then inside the denture, there's what's called an anchor that is positioned and acrylic inside locked inside the denture, so that the denture clicks, the caps click into the locators and hold the denture in. So the first thing to talk about is, this is the standard, the baseline level of care. What is it like? Well, it still has some movement when people chew on the back of the denture, but it's not flopping out of people's mouths. This is something that, when in place, you can bite into an apple. You can bite into a sandwich. There is some, as I said, rock on the posterior, but it is a game changer, especially for those folks that have been in dentures for a long time. I love transitioning people that have existing dentures. And I gotta tell you, people get worried about health and, can I do this? I'm in my 80s. Yes, we will cater everything towards your health history. We'll look at it, but I have patients in their 80s and 90s that we're doing this to better their quality of life, to go from tapioca to ribeye. It's a big deal for those that eat steak or carrots. So the key is, though, this is the minimum. And when I'm gonna be as candid as I can. This isn't gonna be exact numbers, but I really want people to have an understanding of ranges of cost. Okay, so to do something like this with a new denture, let's say you need a new denture and 2 implants, it's around $6,000, start to finish. And that is where people start deciding. Usually one of the big deciding factors is cost. What do you want to invest? And as we go, I'll explain the difference in cost and also the pro and con. So pro here, ton times better than having no implants. It gives you great success, and it's really at a reasonable cost for what you're getting. And then the next step up is also an overdenture. It's something that is the same exact restoration setup, except what we do is we go and put 2 implants closer towards the posterior. It's actually not all the way in the back, but usually in the premolar region, because the bone is excellent there for most people. And we get 4 posts now that the denture is supported on, which prevents that anterior-posterior rocking. What does that mean in English? It's more stable. In fact, I have a lot of patients that their biggest issue is popping it in and out, which we want. So it's more stable. That does add to the cost, approximately another $5,000. So you're looking at a range of about $11,000 or so to do something like that. But it is absolutely stable. Should mention, implants are warranted for life. So if there was an issue with the implant, the company's warranty, and then we warranty that side of it. There's very low incidences of issues with the prosthetics, but I should also mention there's a wide array of different types of prosthetics that are out there, and that does change the fee slightly based on lab costs. And what's the difference? Chance of later on having chipping or fracturing. All materials are repairable. It just really comes down to what you want to deal with. So we can go deeper with that if you want to talk about it individually. But those are the real basics with overdentures. They're removable. Advantage there, you can pop them out and clean very easily around everything. Disadvantage, you can pop it out and psychologically your teeth can come out, or your bridge. But let's move forward to some other ways to go. The next topic is what we call hybrid dentures. And really the best way to explain it is it's this same style of denture. It has some edges, some pink acrylic that covers around the bone slightly. And the difference between an overdenture and a hybrid denture is we design it where it actually gets screwed in the mouth. We have little relief holes that are on the back side of the teeth, strategically where the implants are, and we're actually able to put it in the mouth and screw it down. The patient can't get it out. Even more stable than locators, there's no movement at all. This is for the person who doesn't want to know that their teeth come out. The major disadvantage is debris and plaque underneath these things. It is a must that you come and get service and have us unscrew it and clean it at least every 4 months. In some cases, it ends up being every 2 months. So it's just, in each of those visits, we do the first few for no cost, but then it's $150 or some fee like that. So there's back-end fees. Plus, there are with these hybrid dentures, by research, at the 10-year point, 30% of them fracture the denture itself. And what it has to do with is the forces on the actual denture itself. The actual denture is not strong enough for the fact that this is statically screwed in place. Then you go and do massive bite force, and one day, 10 years later, the acrylic breaks. I just had this the other day. Now we're down the road of making a new appliance. This time he's going to go with the hybrid bridge, which I'll get into in a moment. But so the advantage is cost is still where it's in the more reasonable range. And we're looking, once we get to the screw retained with all the parts, the hybrid denture is around 20 grand for an arch. So about 18 to 20 grand is a good estimate. You do put a few more implants in place. So there's usually about 6 implants depending on what bone is there. And as we go into the hybrid bridge, the first word, this is the key, hybrid. Hybrid just means we can screw it in and out. It also means it's fixed in place when you leave. You can't remove it. So that's the same implant setup. Usually we have about 6 implants in place for further strength. The difference here to here becomes the actual prosthetic. An implant bridge, the reason we call it a bridge, is it doesn't have the pink. It doesn't have all the excess acrylic that comes and laps around your bony ridge. Instead, it's much more like a long-spanning prosthetic bridge that would be cemented to teeth. So there's areas where there aren't implant connections, where there's pontic or fake teeth, but when you feel with your tongue along the edge, it feels much more like just a set of teeth. I'm going to show you that in a picture. Let's see if we can get this back on. So this, once we have our energy saving sign go off, this is what's called a Zirconia hybrid bridge. This bridge is the best restoration on the planet for reconstruction. It is absolutely indestructible. And why? It is a puck. It is milled out of a puck of high-strength zirconia, which is a ceramic, the hardest ceramic out there. And it's then this is a little fuzzy, this picture, but it's absolutely cosmetic. And you can see it's designed with the implant housings exactly where the 6th implant goes, and you put it into the person's mouth, and from the back side of it, it has screw holes that you can torque and screw this in place. It's like Jaws from James Bond. And so ticket price, usually $32,000, $32 to $35, depending on some part details. And that's for an upper arch. When we do an upper and a lower, if it's full mouth treatment, it doesn't end up being 70 grand. We do get some discounts from the labs, but it is in the 60 range. So, but look at the value here, guys and gals. It's, you know, I think about people spending. I think about what you're investing in. You know, are we investing in a big Mercedes, or are we going to put something in to totally reconstruct my entire lower face and get it where I can eat whatever I want and that nothing can fail? No pain, no problems. That's worth its weight in gold. So there's a lot of complex details to this. I tried my best to summarize it. It really can go into about an hour to 2 lecture. So please give us a call or give us a message. I'd love to converse with you about more details about your condition, and like I said, have my great team talk more in detail about the cost end. I tried to give you an overview. I wanted to be an open book so that you could get an idea of what ranges we're in. So, circa 2020, and have a wonderful day.